and Brad, the two most famous physical therapists on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together, we are the most famous physical therapists on the internet.
Well, in our opinion, of course, Bob.
Today, Brad, we're going to show the folks out there how to increase knee bend, minimize pain after knee replacement or any type of knee surgery. And kind of the big part of this is using the TENS unit.
Right, yep. And this is something we've used in the clinic, and we found good success with it, particularly if the people don't tolerate pain meds.
You know, and it's not that far of a stretch because... because they actually, after some surgeries, they actually implant TENS types units in the body.
Sure,
So,
that's
I
a
mean,
common thing with, well, I should say common, but with back pain, you know, it can be one of those deals.
Exactly. So, by the way, if you're new to our channel, please take a second to subscribe to us. We provide videos on stay healthy, fit, pain-free, and we upload every day. Also, you want to join us on our social media platforms because we're always giving away stuff for one thing.
That's right.
Instagram, I just had a funny thing on there. I thought I did something funny. I thought I was the one that came up with it. And so
you were?
Yeah. But anyway, what are we giving away right now? We're giving away the breather.
The breather.
Yeah.
Okay.
So if you're having trouble with COPD, asthma, sleep apnea,
sure,
this is the thing for you.
Yep. So. We're a friend. Okay, very good, Bob. Knee surgery.
Okay.
I believe for total knee replacements, we're over 800,000 total knee replacements per year in the United States. And I have a feeling that number is up since I got those stats.
Yeah, I saw just recently it's going to go up to, like, by 2000, what was it? It was like 20,000 a month or so. It was just great numbers.
Right. And after surgery, and this goes for ACL or meniscus surgeries, anything after surgery with a knee, you want to get that knee moving as best as you can and as soon as you can so it doesn't contract and become a stiff, problematic knee. So one of the big things you need to do is minimize the resistance of doing the exercise. Now, one thing that most hospitals do that I'm aware of, they throw a towel down on the floor and they say wax the floor to get that knee moving because the towel offers less resistance. Well, we have one step better. You want to minimize it. We use this knee glide, and it works really well.
Yeah, and I've seen the difference between using a towel and using the knee glide. The knee glide just eliminates the resistance, and so it makes it so much easier. The other thing with the knee glide, Brad, is that you can get this angle. And a lot of times people, it's a little bit hard on the ankle to go like this. See, watch what I'm doing. I'm putting a lot of stress on the ankle right now. This way, there's no stress on the ankle.
Right. It minimizes, you want to minimize the other resistances, not from the joint to the hip. So we're isolating it to here. And then plus you're going downhill. Now, this may seem like a little thing, but when your knee after surgery is very weak and you have pain associated with it, these little things can make a big difference.
Right. And plus you can do it on carpet. You can do it on any surface. So it's lightweight. You can carry it around.
Yeah. So at home, it really helps out as well. So what you want to do is
number one, minimize resistance.
Right. Next is you're going to have to do some passive range of motion or actually kind of force the knee to bend. Now, some knees go pretty easy and some knees are challenging and tight. Those are the ones where this really can be beneficial. And one of the rules I always do with a total knee patient, I like to keep my hands off. I don't like to put my hand on there and push, although I will, depend on the situation. But usually people are more relaxed. They bend better if they're in control.
Absolutely.
Of the bend.
I've seen this all the time. And that's why a lot of times we use the new step, the larger machine, because they're in control. But even with this too, I see better results when they know I'm not pushing on it.
Right.
People don't trust each other.
Well, it's kind of a natural thing.
Yeah, it is.
Someone's creating pain and you're not in control of it. You're just not as relaxed.
And, you know, it's a little bit shocking how painful the knees can be after surgery. One of the girls that works for us, she had a knee replacement after years of working with people with knee replacements. And she was like, oh, my God, if I knew how much it hurt, I wouldn't have been that mean, she said to other people.
She's a therapist.
Yeah.
So you're going to do this for about 5 minutes. Now you can go pressure on, pressure off. And what I have people do is I have them just kind of working in a pain-free range. And then about every 10 or 15 repetitions, I'll say, push it harder. And if you take your good leg and go over the top on your ankle, and then you push and hold and let it off, and then let it relax, and then go back to the more pain-free range. And then again, 10 to 20 reps, give it that long push. Now, there's some therapists I've worked with where they will have people push it into a very aggressive, painful range and hold it for 30 seconds. And I think there's some research on that. That's why they do it. That says it works well. It has good results. My personal opinion and results with patients, it's very painful. They don't like it. They hate coming to therapy.
Yeah, there's a psychological component to
it.
Right.
So, that's the way I treat, and I think Bob is along with that.
Yeah, and the other thing, Brad, when you get so far, the ankle doesn't work anymore, across here. So then you go off the top of the foot like this, and that works just as well. And then you can go even further then.
Yeah. And, you can really get some nice bend. Now, if you got a real stubborn knee and it's really painful and doing all this and you're using your pain meds is appropriate and the doctor says, no, we can't use any more pain meds, that's when I'll go to the TENS unit.
Right.
And the TENS is specifically made.
When the pain is an overriding factor that's really preventing things from happening. Right. This is a great thing to do.
And I worked with a couple therapists that were doing this much longer before me, but it was nothing. If you have a stiff knee, tight knee, painful knee, you want to eliminate that pain as much as you can. So the TENS unit, transcutaneous electromuscular stimulation, it's a mouthful. We'll just call it TENS. That masks the pain while you're pushing through that range of motion. And also it can give some benefits for swelling.
Right. It could actually contract the muscles a little bit and get some of that edema out of there, which also helps decrease the pain.
Right.
So
if you're one of those people that have a real painful knee, this is something you'll want to watch. Now with the TENS unit, you may want to have a therapist guide you through this initially so you get used to using it, and then you can do it at home just as well. We've used a lot of TENS units over the last 20 to 30 years, and we're really happy with this I Relieve unit because it's plenty strong. It's got plenty of power. It's easy to use, and like this one, there's no batteries in it.
Right, they recharge.
You can recharge it.
Which is fantastic because it used to be such a pain to have to replace the batteries quite often, actually, on these things.
Now, the way I like to hook this has got 2 channels, which most TENS units do, and I like to hook them up, both channels. You can just use 2 pads, but I'm going to use 4. That makes 2 channels, two pads per channel.
So look how he's got the knee nice and surrounded.
Yeah.
It just creates a good halo effect of decreasing the pain.
So I've got this channel connected here and here, the other channel here and here, so make a crisscross pattern. Oop. There we go. Okay. That's the way I like to do it.
Right.
There's a treatment called IFC. I'm not going to get into that, but that can be very beneficial for pain
and
as well as
that's how you hook up IFC is in the same manner.
Exactly. So now, can you see this, Liz? I like this. It's easy to use. I'm just going to hold the on button for a few seconds. We got it going. The program mode is something you have to look into per the TENS unit.
That's not what you're doing on this video. It's not showing.
No, exactly. But I'm just going to go through how we get this going. So I got it on TENS. This one, it could be used for
EMS too.
EMS, but we're not going to work on that. That's a different treatment. And I'm going to go on P3. That's the mode I personally like with this TENS unit. There's 8. There's P1 through P8, 8 different settings. Pick the one that works best for you.
And you can actually try each one and see what it feels like and which one seems like it reduces the pain the most for you. And just for me to interject, Brad, I mean, the EMS unit could possibly be used for the knee replacement too, because you want to re-strengthen the knee too.
You bet.
So it does serve a double benefit that you could possibly use this for.
And then after that, you push the mode again, P3, and then the time. I'm going to go 20 minutes. It goes up to, I believe, 60 minutes on this one, increments of 5 minutes. And then I want to go to my next mode.
Yeah, so what's nice about it is you could set it up for like 60 minutes and you could work on your knee for even just 5-10 minutes and then keep it in place so that you're having decreased pain even after you're done working it. So it helps you get through the rest of the day, and maybe you can get off your pain meds sooner once you're using the TENS. You don't have to stay on them as long, and we're always trying to get you off the opioids as fast as possible.
Right.
Do you know what you're doing there, Brad?
Well, you just keep talking, Bob.
I'm trying to fill some time here.
Well, I was just about ready to go, and
You messed something up?
No, I don't know. I didn't mess it up. I just went. I accidentally got the EMS.
So Brad is still trying to figure this out. It is an easy to use unit.
Okay, here we go. No, I was on. I just wanted to get the channel 1. So now I'm on 9 milliamps, and I'm just going to go up. And you can start to feel the tingling. 25, and I'm going to hold it there. I got one channel working there, and now I'm going to go to channel 2. And you probably can't read it there, but I'm now on channel 2, and I'm going to increase the resistance there. You can
so
feel.
I can see that one moving now,
Yep.
Brad. If you actually turn your knee,
Yep.
I don't know if you can see that one popping up
Yep.
and down.
I'm right over the VMO, right over that trigger point, so that's going to activate that way. And I'm just going to go up till I feel comfortable with that.
So he's right over the vastus medialis.
Obliquus, right? Yep.
Part of the quadricep,
Yep.
and it's really firing up now, as you can see. And I don't know, is that comfortable yet for you?
Oh,
Brad?
yeah. It feels fine. I could go a little more with it. I'm not going to. I've got both channels working at a rate that feels good, but you can go higher. And when you first start out, I wouldn't go too aggressive.
So are you comfortable in working on knee flexion while that's going on?
Oh, yeah.
It is. Okay.
Yep. And work with the patients the first time. Again, you take it easy just so they know what to expect. You got, muscle that's firing, and that's okay. The other one's not, because I'm not over trigger point on those muscles. But you're just going to do the same thing. You're going to work your range of motion. You're going to push it and hold it, and then relax and work that for 5 minutes. Now, and then after they get used to it, I'm at 25 setting here, and then I'm going to go up. I may go up to 30 to 35, whatever it may take, and continue to work with that.
Well, Brad, we're kind of coming to the end here. After you do all this, you probably want to throw a cold pack on afterwards,
right?
When you're done, right?
And you actually can do that with the TENS unit going if you'd like to.
Keep the TENS unit
Yep.
going, so.
All
right. Well, that wasn't the smoothest presentation, but I think we got the idea across.
Yeah,
so,
right.
All right. Thanks for watching.